Good luck, everyone. Well, welcome everyone on behalf of the organising committee to the third webinars in our series comprising the Symposium on Global Health Policy and Research, organised by the Global Health Policy Research Forum. My name is Associate Professor Stephanie Topp. I work at James Cook University in Australia. And the theme for our seminar today is the politics of regulating commodities that harm health. Fong, could I get you to put up the slides, please? Thank you. So next slide. So just before we start, a little background on this series. This is the fourth in a series of symposia on global health policy and research. The first of which was actually held at the American University in Washington, DC back in 2016. And it was organised with the goal of sharing research on global health policy and policy making and building a global community of researchers who apply social scientific theory and methods to the study of global health policy. Our last symposium was held in 2018 in Liverpool in England, and it piggybacked on the Health Systems Research Symposium 2018. And following that symposium, a steering committee of researchers from around the world was formed, and it is this committee that has organised the current symposium. Next slide. So the committee members, all of whom are researchers working on global health policy, have put a considerable amount of work into sort of designing a program and organising the event, which was originally planned to be an in-person event aligned with the HSR 2020 conference that has just been, and which was originally going to be in Dubai, but obviously because of COVID went virtual, and so also did this Global Health Policy Research Symposium. So just to note, it's the members of our organising committee, Karen Greppen from the University of Hong Kong, Aaron Malaki from the African Constituency Bureau of the Global Fund, Marsha Orgel from University of Cape Town, Kathy Reyes, my co-host today from the University of Philippines, and Kathy will be helping to moderate the session, the Q&A session a little later today. Kerry Scott from Johns Hopkins University, Jeremy Schiffman, also from Johns Hopkins University, and myself. Next slide. So as a means to help build ties amongst researchers in global health policy, the committee is really pleased to remind those of you who are actually returning from previous sessions, as well as those of you for whom this is your first webinar with us, of the establishment of the Global Health Policy Research Forum. We intend through this forum to organise future symposia, as well as to undertake additional activities that help build linkages amongst global health policy researchers and around the world. For more information about this, and if you're looking to stay engaged, please visit the website listed here on the slide, or go to our Twitter handle @GlobalHPR. Our aim is to build a global community of researchers who draw carefully on social science theory and methodology to study global health policy and policy making, and to make power relations in global health visible. Next slide. So just quickly, we wanted to acknowledge the Alliance for a Healthier World of Johns Hopkins University, as well as the Social Science Thematic Working Group SHAPES of Health Systems Global for providing financial support for the symposium. And we also want to thank Mo Elahi and his IT team, Brittany Menina, but particularly Fong Trong, who is operating our sessions behind the scenes, all of Johns Hopkins University for their technical support. Next slide. As many of you would know, we have already had a plenary plus 2 themed panels. And there will be 2 more panels over the coming Tuesdays. And these are listed up here on the slide. If you've not already done so and you're interested, we really encourage you to register either by going directly to the website or to the registration page. Next slide. But that brings me, without further ado, to today's esteemed panel. And I'd like to briefly introduce you to our presenters today. So first up, we will have Gordon Shen. He's an assistant professor in the Department of Management Policy and Community Health at the University of Texas Health Science Center at Houston School of Public Health. Next, we'll hear from Connie Hoe, the assistant professor at Johns Hopkins Bloomberg School of Public Health in the International Health Department, as well as the Health Systems Program. Next, from Lana Elliott, a lecturer at Queensland University of Technology and also a PhD candidate at James Cook University. Next, Talia Rebeca Haro Baron, a PhD candidate in the Faculty of Political and Social Sciences at the National Autonomous University of Mexico. And Shinjini Mondal, a PhD candidate in the Department of Family Medicine at McGill University. I would also like to introduce our discussant for today, who is Dr. Belinda Townsend. Belinda is a research fellow with the NHMRC Centre for Research Excellence in Social Determinants of Health Equity, as well as the Deputy Director of the Menzies Centre for Health Governance at the School of Regulation and Global Governance at the Australian National University. In terms of the format for our session, we will have each of our presenters detail their material in turn, and we're then going to invite Belinda as the discussant to share her thoughts on the emerging themes, tensions, and areas of future research that she sees implicated in this work. Then during the final 40 to 30 minutes, we're going to open up the floor to questions that you, our audience and participants have logged. So as our presenters are speaking, please submit questions and comments through the question and answer function that you'll see at the base of your screen. Kathy will collate and select questions to pose to the panelists that we'll have as part of a moderated discussion. And I would also welcome all of you to actually introduce yourself to everyone here via the chat function, and to list any comments that you're interested in posing to the broader group via that chat function. But with that, let me now turn this over to our first speaker. So Gordon, over to you.
Thanks, Steph. Thanks for organizing this panel. It's so great to be here with esteemed panelists and Belinda. So I wanted to present to you a study that my collaborators and I have been working on for 2 years, and it's looking at the use of knowledge in sugar-sweetened beverage, and I'll just call it SSB from here on out, tax policy development in Mexico and Chile. And I should also thank CUNY for an intramural grant that funded this work. And so let's move to the next slide. So I'll start with the theory. It's anchored on social epistemology, and which is interested in the normative issues surrounding the organization of knowledge very generally. And there's a lot of discussion in that body of literature on the production, distribution, consumption of knowledge. And in our study, we're particularly interested in consumption. There are, if you trace back to the philosophy, there are stances on the realist side, which tends to be taught a lot in schools of public health and risk decision science around identifying alternatives. And the one alternative is always the status quo, which is do nothing, against other alternatives, and having a criteria using evidence to drive decision-making, choosing one as a course of action and justifying why. There's another school of thought, which is constructivism, and it's accepting that there are multiple different cognitive frames and schemas in the interpretation of issues. In our case today, it happens to be around syntaxes. And there are interesting frameworks that's a mix of the realism and the constructivism perspective. And the one that I find very useful and a departure point for this work is the advocacy coalition framework. And in it, there's a subsystem of different types of actors, and that they converse with one another. And not only in terms of bringing to the fore the knowledge that they themselves use, but how do they converse with one another about the knowledge that are pertinent to the issue? And the subsystem is very much corralled around the issue itself and the policy that's developed to address that issue. So with that, let's go to the next slide. When we started this study, it came at the heels of the replicability crisis in academia. So many of you in this audience are aware. So I was thinking a lot about knowledge, not only because the credibility of the epistemic community is at stake, and certainly the researchers who are implicated, their reputations are at stake. And so, you see a fig leaf on the right for that reason. I think it's, as researchers, we're taught to critically think about, what is the design and what is the rationale and what is the evidentiary proof, right? And so if you're holding a document, your critical skeptic reviewer would be asking, is there anything that's being hidden, right? And that's a somewhat different, sort of claim than the picture on the right, which is, are you just using evidence as window dressing? Okay. So anecdotally, we have these two kind of questions about evidence, even outside of academia. Next slide. We started with epistemology, and we chose two cases in Latin America. We chose Mexico and Chile for several reasons, which you see, kind of neck-to-neck comparison in this table. I won't go into the specifics, but suffice to say that Mexico's SSB tax is very much volume-based, whereas Chile's is based on the base price. Chile's tax policy also has a historical precedent. It started in the 1920s, and so for soda, it was an incremental change. And these are both high income or upper middle income country, and with high SSB consumption on per capita basis. And then you see the figures down there that are more epidemiologic in focus around the prevalence based on BMI measure in both adults and children. And also the inferences that can be made around BMI as a cause for premature death. And then further upstream, SSB as a determinant of BMI. All right, next. So what do? We use two main qualitative methods. One is semi-structured interviews, and another is bibliometric analysis of documents. On the interview side, we conducted 24 interviews, and we were very cognizant about having an even sampling distribution across 4 different actor types that you see here, which is government, industry representatives, researchers, and civil society members. And we conducted these interviews over the course of 6 months in both Spanish and English. On the document analysis side, it's not only peer-reviewed literature, but also graded literature and literature that were provided to us by interviewees, particularly industry interviewees. And so we ended up with a corpus of about 251 documents that specifically focus on SSB tax policy in Chile, Mexico, and Latin America, published between 2009 and 2017. Okay, next slide. So we found in triangulating the data and looking at emerging themes, 3 themes that came up over and over again. The first one is the evidence was light. And so there's a quote here, short one, that says, the development of, this is a global researcher, GR. And so remarking on development of SSB tax policy to not be evidence-based policy and evidence-informed policy. What do they mean by that? And if there's time, there's an extra graph I can show you on the publication trends. And the majority, especially in Chile, the evidence were published after the enactment of the SSB tax policy. And in Mexico, you see actually a spike in the year before the passage of the tax policy. And so there's a reverse of the trend here, is the point to underscore based on this quote in the publication trends. And so without solid evidence grounding, government respondents in particular talked about how they consulted experts. Okay, next slide. The second theme is that respondents were very clear about 2 causal arrows. And so in terms of causality, one is the inverse proportional relationship between SSP tax and consumption. And the second one, which they were for the most part more uncertain about and have less confidence in convergence of the relationship, is the direct proportional relationship between SSP consumption incidence of NCDs. And the two sub-bullets here are reasons that they usually endorse as to why they're not uncertain of arrow 2, but they're very much certain about the first causal arrow. And indeed, in our corpus, out of 251 documents, there were only 3 that are systematic reviews. All right, next slide. I, tinkered around with, this title. I didn't know whether to call it contestation and concession or contestation and consideration, but probably in a more neutral sense, I'll probably end up with the latter. But in terms of contestation, you can imagine that when we ask respondents about, other types of actors and their use of knowledge, there's a little bit of like finger pointing and saying, of course, like, these other actors, they'll just conjure the evidence that supports their point of view and their position. And so that's the contestation, the strategic deployment of evidence piece. Now, with the concession piece is that when we look at, the references for selected documents from each of the 4 types of actors in Mexico, Chile, and Latin America, and we put in a matrix, we pulled all of those references and actually coded them on who cited whom. You can imagine that the majority of all 4 types of actors tend to cite researchers. And so, of course, researchers citing researchers, there's a citation homophily there. But other types of researchers that tend to cite research, we found those statistics as well. And in terms of the volume of citations, government of documents tend to cite the most, tend to have the most references. And then second up is research, third is civil society, and fourth is the industry. Okay, next slide, please. So with these 3 themes, and it's really probably no surprise to my fellow panelists here that these 3 themes have come up in our study and probably recur in theirs, and you'll hear about it. But we treat them really less as themes and more as like analytical dimensions. And with these 3 analytical dimensions that we've also seen in literature about other syntaxes, we want to proffer this concept of policy receipts, which is the minimum evidentiary proof that's invoked to support one's own position on a policy. And we proffer that concept for several reasons, not just because of the 3 themes that I presented, but also because in the decision-making literature, there's the notions of bounded rationality and cognitive overload as held by Herbert Simon. And so we want to give support to that in this case study. In wrapping up, I should say that the limitations in any interview is a recall issue. It's also, we didn't look critically enough in each actor and how they manage knowledge. And then amongst actors, I think there could be more work within this subsystem on knowledge transfer amongst the actors and not just across geopolitical borders. For future research, I mean, there are lots of wonderful comparisons. WHO has best buys on obesity interventions. And of course, we can look at within the same country or the same region, the types of syntaxes and what that policymaking process is. But I think what's more interesting is in thinking about the tie-in to international development, which is the knowledge used in multiple different policies, water, sanitation, environment within the same country. And I think that there's some cross-fertilization in the international development and political science IR literature that could be had there. And I should also underscore our methodology, which we liked and we ourselves would want to do more of, which is inspired by information, library sciences, but also there's wonderful literature out there on like linguistics and really digging into the content. And, so I think that's a, method-wise, like a vector in and of itself. I think any presentation you sit through these days would be tone deaf without mentioning COVID-19. And I myself, as with a lot of other researchers, have so much literature coming across my inbox that, I started, I'm almost done, Steph. I started a file in my inbox, which is called Misinformation, Fake News, and Attention Economy. So if you go to the next slide, Phong. I mean, and just keep clicking through it. I mean, these are, all the exhibits, right, of, questions about science. And it's a tie-in to issues around vaccine hesitancy. And so skepticism about, what can science bring to the fore. So for us, in the last slide, if you go to the last slide, I think that should be it. Yes. For us, we just started with thinking about, that bell curve, which is diffusion of SSB tax policy. And it led us, down a path which is much more about knowledge use. So I'll just pause there. I'm happy to answer any questions and triangulate my findings with others. Okay, thanks.
Thank you so much, Gordon. I'm hoping to see some questions come through on that, but for now, we will move straight on to Connie's presentation. Over to you, Connie.
Great, thank you so much. Hello, everyone. Really delighted to be able to be here and tell you a bit about my study, The Battle to Increase Tobacco Taxes, Lessons from the Philippines and Ukraine. So tobacco use is a major public health concern around the world, but fortunately, we know what the evidence-based, cost-effective interventions are. And one of these evidence-based intervention is raising tobacco taxes. And this is because a lot of evidence showed that raising tobacco taxes can reduce initiation, it can decrease consumption, and it also can reduce relapse. Unfortunately, however, next slide. If you take a look at this figure, you'll see that few countries, 38 countries, the ones highlighted in blue, actually have taxes as high as the international best practice recommendation. And of the 38 countries, only 15 are LMICs. Fortunate thing is, there are some LMICs in recent years that have made significant strides to increase taxes to align with international best practices. One of these LMICs is the Philippines. In 2012, the Philippines passed the sin tax reform law that was a significant departure from historical taxes on tobacco and alcohol. So this law essentially indexed tobacco and alcohol taxes to inflation. It removed the classification freeze for tobacco, and it also, the revenues generated from the tax was also earmarked for health. So that was a huge achievement. Ukraine too, in 2017, passed the 7-year plan to increase tobacco taxes, which essentially allow the country to increase taxes on tobacco products from 2018 or 2019 to 2024. So, what explains these successes? What are the factors that contributed to them? That's what we wanted to explore in this study. And so we used a multiple case study approach that was guided also by the Advocacy Coalition framework. And right now, I'm just going to tell you a bit about the key things that emerge from the cross-case analysis. Next slide, please. So the first thing that happened was in the Advocacy Coalition framework, they talk about external events, or like similar to what Kingdom would say, like almost like windows of opportunities that trigger instability of the policy subsystem and tip the scale in favor of one coalition versus another. And so what happened in both countries was that there was this external event that happened. In the Philippines, this was when Aquino III became the president, and his priorities were to increase tax collection efficiency and to achieve universal health care. And so sin tax proponent took this as a opportunity. They seized the opportunity and to convince him to use the sin tax to pay for the universal health care, which he promised during his elections. In Ukraine, in 2014, the president signed the Ukraine-European Union Association. And this association included a directive which specified the structure and rate of excise duty to be applied to manufactured tobacco, including a minimum rate of 90 euros per 1,000 cigarettes. And this association agreement came fully into force in 2017. And so if Ukraine wanted to be part of the EU, they had to harmonize. And so this also provided a great opportunity for the proponents of the tax policies. Next slide, please. So after these external events happened, the actors worked in multisectoral coalitions, including actors from both the health and finance sectors. Now, what's really interesting for tobacco taxes is that the finance sector in both countries have been more involved in tobacco taxation and promoting to increase tobacco taxation than health. During the sin tax reform movement, Philippines was successful in garnering the support of the health sector. Ukraine also was able to get some support, but they weren't as successful as the Philippines. So in this coalition, in addition to the usual tobacco control advocates, we also saw respected economic groups in both countries. And by respected, I mean in the eyes of policy makers. So in the Philippines, that was the Action for Economic Reform. This was an economic think tank, as well as the World Bank. And in Ukraine, World Bank also played that role. So in both coalitions, we also saw experts who can generate timely evidence. And this was so important because during the legislative process, policymakers may have questions, and the industry are also, making arguments and using tactics to oppose the policy or the bill from becoming law. And so the proponents had to really quickly address questions and neutralize industry arguments. And so they also need to back it up with data. And so it was so helpful to have these experts who were able to very quickly generate evidence and in order to convince decision makers and counter industry arguments. So in the Philippines, this role was played by a local medical doctor, and in Ukraine, this was a local tobacco control researcher. Next slide, please. So in both countries, the coalition of proponents had a very rigorous understanding of the political economy, and that's why they were able to identify these key entry points. And we saw that they were able to tailor their arguments and tactics accordingly. In both countries, proponents used a multi-pronged approach, meaning different tactics, including lobbying, media advocacy. In the Philippines, for example, they also used demonstrations. Next slide, please. And of course, evidence was important. And so it's proponents or key informants emphasized the use of local data being really key because they had to generate models to show government officials what was the impact of the taxes on revenue as well as health. And so if you had data from other countries, it wouldn't be as convincing. So you needed local data. However, international experiences was also important because the industry uses very similar arguments. Smuggling, they, say that if you increase taxes, there'll be smuggling, illicit trade. These are very, common arguments that they use around the world. And so having these international experiences, like experiences from the World Bank, was very, very helpful too. Next slide. So even though, there were an external event that tipped the scale in favor of the proponents and they worked in coalition to pass these great laws, unfortunately, the coalition of opponents was also very strong. They also used an array of tactics, including lobbying. They were very close to the key committees in the legislative process. So for example, this is from a news article that showed that the tobacco companies were present at an emergency meeting held by the Committee on Tax and Custom Policy in Ukraine immediately after before the first reading of the bill to vote on the terms of the bill to be included in the 7-year plan. So unfortunately, as a result of industry interference, the policy in Ukraine, the two key things that were watered down was that one, the the increase to inflation was supposed to be mandatory, but it became optional. And the tax increase, the proponents wanted it to be in euros because euros were more stable. It was converted to a local currency. And in the Philippines too, they wanted a higher tax increase, but that wasn't possible because of the compromise with the industry. However, it wasn't as detrimental to the tobacco control movement because the sin tax encompassed both alcohol and tobacco, and a lot of the sacrifice was actually made to the alcohol component so that the two industries don't join forces. So in addition to these lessons learned, I think one of the key implications too is that it is so important to implement the FCTC, Framework Convention for Tobacco Control, Article 5.3, that protect tobacco control from vested interests. Thank you.
Thank you so much, Connie. A really interesting set of observations, and also an interesting lead into Lana's presentation, also talking about taxation, but back to sugar-sweetened beverage taxation. So Lana, over to you.
All right, thank you so much for having me. And it does feel like we're on a bit of a roll with taxes. So without further ado, in keeping with the spirit of reconciliation, I'd first like to acknowledge and pay respects to the traditional custodians of the land on which I stand today, the Turrbal and Yagara people. And I'd like to extend that respect to all Indigenous persons engaged in the Global Health Policy Research Forum. So this discrete piece here, looking at Vanuatu's sugar-sweetened beverage tax, is part of a larger body of work, analysing the political economy of NCDs in Melanesia. So for this work, I owe a great deal of gratitude to my fantastic supervisory team and co-authors, Dr. Nande Wanga, Dr. Sarah Douglas, and Associate Professor Stephanie Topp, as well as a great array of Ni Vanuatu and regional informants, colleagues, and friends. Next slide, please. So our focus zooms in on the Pacific region, a region to date often under-recognised by the global health community and underrepresented in our field of health policy and systems research. With 22 distinct countries and territories scattered across more than 15% of the Earth's surface, these small island or big ocean states are home to 12.3 million people. The region is disaster prone and substantially impacted by climate change, and health systems contend with the double burden of remaining communicable and emerging non-communicable diseases. Yet, with necessity the mother of invention, Pacific health actors are drawing on some fascinating health policy solutions. Now, whether a solution, a backstep, or a sidestep, I'll let you decide. But today we're looking specifically at the introduction of sugar-sweetened beverage taxes. Thanks to my panelists, you've had a bit of an introduction to these so far, but heralded as a health and economic win-win, or Best Buy by WHO, the concentrated uptake of these measures, now present in 9 Pacific Island countries, at the surface appears to represent a fantastic win for health. Yet when we dig below the surface, it's important that we ask some more prying questions about the respective power dynamics and the institutions and contestation of ideas and interests. Was health really the driving rationale and winner in this unique policy space? Next. So it is for this reason that we turn to Vanuatu, a low and middle income country home to 290,000 people spread across 83 separate islands. The country experiences a sharp escalation in NCDs, and premature morbidity and mortality associated with diabetes and cardiovascular disease in particular place an unendurable burden on the already economically and geographically strained health system. Seemingly as part of the nation's response to NCDs, in January of 2015, the Vanuatu government introduced a 50 Vatu per litre tax on sugar-sweetened beverages. Next. Preliminary process tracing of this policy demonstrates the following milestones. So in late 2012 to early 2013, the idea of a sugar-sweetened beverage tax was conceptualised by the government of Vanuatu. Then in early 2013, a coalition was formed between the Ministries of Health and Finance, and Health then presented the idea of a sugar-sweetened beverage tax at a government-wide revenue generation conference in February. Then in March of 2014, so more than a year later, a joint proposal to introduce a 50 Vatu or 43 US cents per litre taxation on sugar-sweetened beverages was endorsed by the Council of Ministers. Then finally, in December of 2014, the amended Excise Tax Act was included in the Parliamentary Gazette, signalling that on the 1st of January, this taxation would come into force. Next. Yet, digging a little deeper, over the same period of time, so from early 2012 until the middle of a year post-implementation, the country also saw a sustained drop in overseas donor aid. Vanuatu gained access to the WTO. Next. The NCD STEP survey was undertaken. The Melanesian Spearhead Group, a regional partnership, endorsed a renewed trade agreement. A plan to decentralise the Ministry of Health saw directorates disbanded and health workers suspended, while a subsequent review into said decentralisation saw WHO removed from the country. Next, national guidelines on healthy diet policies on NCDs and nutrition were released. However, at a very similar period in time, this paper came out explaining that equipment error had led to overinflation of diabetes across the region, including in the STEP survey and subsequent policies. At a political level, Vanuatu also saw 4 prime ministers, 4 ministers of health, 5 ministers of finance, 6 ministers of trade, and countless DGs. Next, while a Category 5 cyclone also struck the country, decimating homes, schools, health centres, and livelihoods. Next, while finally 14 MPs were also convicted and jailed of bribery. Next slide, please. So perhaps it's a little more complicated than we first thought. With this in mind, I headed into the field in 2020 Zoom screen to speak to informants across the political and bureaucratic spectrums, with representatives from health, trade, civil society, industry, the media, regional organisations and multilaterals. I wanted to understand how this policy came about, sustained momentum, and was enacted amongst these economic, trade, political and literal cyclones. Next slide, please. And what I got back was somewhat surprising. When explaining to people that I was looking at the sugar-sweetened beverage tax, it wasn't uncommon to receive this response. Next. For those of you that have not kept across your Pacific Creole languages, "You me need one lahemia" translates to "we need one of those." So despite sugar-sweetened beverage taxes being widely supported globally and often a source of pride amongst nations who've opposed backlash to introduce them, there's little recognition of the policy within the Vanuatu context, let alone pride in what from the outside appears to be a massive accomplishment. Next slide, please. Through further exploration utilising the ideas, interests and institutions lens, this lack of recognition appears indicative of a larger issue in Vanuatu's response to NCDs. This being constraints on capacity and institutional turnover. The small public sector and frequent changes in remit and portfolios has potentially obscured the intention of the tax, with those around during its design not on hand to guide its enactment. However, size also appears to have played in Vanuatu's favour, as despite national and international industry opposition being noted in 2014, the size of the market or potentially the projected impact on revenue saw their resistance quietly hampered. Next. Much of this can possibly be attributed to the mutually beneficial coalition formed between health and finance. Bringing health on board deflected revenue-raising retorts, or support from finance meant that the measure was nearly untouchable by other government departments or industry. However, cracks were apparent in this coalition, with some health bureaucrats under the assumption that funds would be earmarked for health, yet from a finance perspective, public financial management principles were never to be circumvented. And it is this unclear definition of success and subsequently the lack of evaluation or adjustment that really demonstrates how diverse interests and ideas have played out in this policy space. We know that from a finance standpoint, in the first 9 months of enactment of this tax, it has contributed 52 million Vaatu or $460,000 to general revenue. But how much this cost has shifted onto consumers, how revenue has been reinvested, what unintended consequences or substitution effects have occurred, and what, if anything, this measure has done to consumption and the nation's disease burden remains unanswered. Next slide, please. In closing, this paper seeks to examine the premise underpinning sugar-sweetened beverage tax and in some ways problematise their representation as unequivocal goods. Preliminary results from our case study of Vanuatu, sugar-sweetened beverage tax, which is just one example of these multilateral policy prescriptions, demonstrates that these measures do not necessarily represent health wins when we unpack the complex ideas and interests of actors who drive adoption. Through political economy analysis and our application of the 3 I's lens, we can better understand how both the process and end products of efforts to adopt and adapt these measures differ from the presumed simplicity and technical efficacy which often frame such global policy recommendations. Assuming that the mere presence of a policy is sufficient negates the complex policy process and the power dynamics and contestation of interests and ideas that undoubtedly shape policy responses to any complex problem. Thank you.
Thank you, Lana. And staying on the theme of, I think, sugar-driven disease, but shifting our focus a little bit to look at different actors, I'd like to invite Talia to give her presentation. Talia, over to you.
Yes. Thank you for this symposium. So my presentation is based in looking from social sciences to public health, taking as a case of study the high mortality rates caused by diabetes in Mexico through the lens of politics of life, which is a concept proposed by Didier Fassin, the anthropologist Didier Fassin. Next, please. Looking at the data on diabetes in Mexico, there has been an increase in the mortality rate caused by the diabetes since the 80s. In the 80s, it was the ninth cause of mortality. And in 2017, it became the second cause of mortality after heart diseases. Diabetes mellitus represents 14% of the mortality rate in Mexico, and it is one of the highest rates among OECD countries. Next, please. Why has there been this increase in mortality caused by diabetes? Well, scholars have started to look at consumption of sugar, and they have found that meanwhile in the WHO recommends that free sugars should be less than 10% of totally energy intake. In Mexico, this is 13%. And from this percentage, 69% is attributable to sugary drinks consumption, and 25% is to processed food. When comparing the consumption of sugary drinks in Mexico with the world, we have that in Mexico, the yearly average is 150 liters. Meanwhile, in the world, it's 25 liters. And in some regions in Mexico, like in southern Chiapas, in southern region in Chiapas, it is until 821 liters. Well, here's a graph regarding how it has been this average volume per capita consumption measured in liters since 2012 until it's forecasted until 2025. And we see that there have been an increase, that it was stopped due to a tax on sugary drinks in 2014. And this tax was part of a broader fiscal reform, which consisted in 10% of tax by liter. So this meant that it was 1 peso for 1 liter consumed. After this date, after 2014, we see that there was a decrease in this consumption, but it's still very high compared with other countries. Next, please. So why is there this high consumption of sugary drinks? Well, there has been argued that since neoliberal policies, including NAFTA in Mexico in the 80s, there has been a change in the food supply chain. So this has implied changes in production, processing, distribution, and also consumption. And nowadays, this food supply chain looks like very similar to the industrialized food system of US. Which were the concrete policies? Well, there was a marketing deregulation, there was a reduction on tariffs by GATT and NAFTA, well, before that, now the World Trade Organization and NAFTA, the regulation of prices, and there has been an increase, U.S. investment into Mexican food and drink companies. So here we have a map of Coca-Cola's investment in Mexico, in the world, and we see that Mexico is one of the biggest markets for Coca-Cola among developing countries. Next, please. Well, I'm interested in looking at how social sciences have looked at this phenomenon at this phenomenon. So, for example, there have been some works who have looked at these regional differences in sugary drinks consumption in Mexico, and they have argued that, for example, in Chiapas, the high number of drinking of soft drinks is due to low access to water, but also that there has been a change in religious beliefs where they have exchanged alcoholic beverages in rice or soft drinks. So in this sense, this approach, it states that due to differences in ethnic, social, and economic conditions, they provoke differences in health, and they provoke inequalities on health, as Paul Farmer, also the medical anthropologist, coined in this term. Then there are other works where they look at the cultural symbolism of this consumption, and they say that there has been, of course, a structural transformation in the supply chain, but also that there has been a change in the cultural symbolism. And in this sense, these drinks have been adopted as part of parties, rituals, and food rules. And for example, that these, for example, Coca-Cola has become a symbol of power and of prestige to give it during these parties. Next, please. I'm going to skip this. And well, before this one, thank you. So, which is the politics of life? Well, the anthropologist Dibir Fassan, he says that life expectancies and mortality rates are not only quantitative indicators giving us a demographic image of countries, but they are also qualitative data offering political insights as to how societies produce and reproduce themselves. In this, in fact, his term is coined for broad interventions ranging from the state, but also with humanitarian organizations, for example. And he says that the state or the humanitarian organizations, they have practical ways in which people's lives are considered, protected, and cared for, or conversely abused and sometimes eliminated. In this sense, it's who the state or who the humanitarian organization is taking care of for or not. And next, please. In this quote, if each society therefore has the mortality that suits it, in the sense that rates correspond to decisions made in terms of social inequality and redistributive justice in particular, then we should definitely turn to the politics of life that underlie these decisions. And in this sense, I would like to highlight that the decisions that were taken, the decisions made by the state that were taken in the 80s by neoliberal policies, in order that change this food supply chain in Mexico, but also how people are consuming products, and that this has had consequences on the mortality rates, right? So with this, and well, in the next slide, this is the final commentary. regarding how these the work of Mary Singer, who says that this is not a pandemic, but a endemic, and that we have to look at of COVID-19, and that we have to look at the underlying decisions that have provoked these comorbidities. So that's it. Thank you.
Thank you so much, Talia. And our final presenter for today, introducing Shinjini Mondal. Shinjini, over to you.
Thank you, Steph. Hello, good morning, afternoon, and evening. My approach or my lens of looking at these commercial determinants aspired from my interest, from looking at a case of a multisectoral policy in India specifically, and tobacco control policy has been in India for last 20 years, the law specifically, and it has been stated widely as one of the policies that we has been able to achieve this kind of multi-sectoral goals. So to start with my presentation, next slide, please. So this is a part of my PhD study. So it has two components. So first, I initially start with the policy landscaping at the national and the state level to understand the policy context, content, and the different actors associated in the process of the policy, because this policy, as stated, has been there for quite some time. I looked at the national level, and for the state level, I took a case of a southern Indian state, Karnataka. So under this, the first phase of landscape analysis, I reviewed documents, mainly policy, plan documents, acts, bills, and great literature, and simply extracted them to an analysis matrix. I also conducted in-depth interviews with the key stakeholders across national level and the stakeholders. They included government officials, decision makers, administrative people in administrative positions, civil society organizations, and other academic partners. So in total, I conducted around 18 interviews, including both the national and the state level participants, and we did a thematic analysis. So for this presentation, I will focus more on the macro context, but also give a little bit of findings from the implementation perspective. So for the second half of my study, which is actually going to the districts in the same state, selecting 2 districts with comparative outcomes of the tobacco control program, doing a mixed method analysis. So first, doing a social network analysis to map different stakeholders across the implementation network in order to find out how the implementation structure looks across both the districts, and also to identify who are the key actors in the network and what's the relationship. And then following an explanatory qualitative research to explore these networks to find out the characteristics and the patterns to explain those networks, and also to capture actual implementation experiences and what mechanisms, and finally eliciting the barriers and the facilitators for implementation. So now focusing on the main landscape analysis, which is the policy analysis. Next slide, please. So for the policy analysis piece, we took policy triangle as a guide to look at the actors, content, context of the policy, and a deliberative policy analysis approach, because this is a multi-sectoral policy. So eliciting and giving importance to response from each stakeholder, which varied across. So looking at the policy context, it is important to highlight that India has a tobacco control law, which is called COTPA, the Cigarette and Other Tobacco Product Act, which came into effect in 2003. And India in the next year, in 2004, became a signatory of the Framework Convention of Tobacco Control. And in the years 2007 and 8, it started piloting the National Tobacco Control Program. And from 2013 to 2018, it was scaled across all the districts of the country. And it's now is a national program, which is called NTCP, National Tobacco Control Program. And also to highlight that, I think that Connie also mentioned, fellow panelists, that in tobacco, we actually have the interventions and we know which are evidence-based, cost-effective interventions. So tobacco had that edge over the other policies or the other areas of NCDs where we exactly know what kind of intervention works and what are evidence-based intervention. Next slide, please. As a part of policy landscaping, I was curious to find out how different actors work together for this tobacco control policy. So in terms of mapping and finding different and the key actors in the policy that engaged with the policy processes throughout, the key and the central role is played by Minister of Health and Family Welfare, as well as the State Department of Health and Family Welfare, because this is a program that is owned by the health sector. So that's why they imply a central role. They convene the expert meetings, advisory group meeting, assess different policy alternatives, draft issues, draft policy guidelines, implementation guidance, and also seek support from associated ministries and departments. The other key actors that are involved in the tobacco control program are the technical support organization. These support organizations provide technical support for policy development and implementation, maybe drawing from experience of other countries, drawing together research evidence to support propositions, gathering experts, providing implementation capacity building for the country. The other group is research organization. They provide their technical and brokering information support. So what they have done is provided a contextual evidence support. So they have contextualized research studies in Indian context. They may be either estimating in burden of disease, doing implementation research, or policy evaluation. I also observed that a bulk of the advocacy and implementation, monitoring, support, and sensitization was provided by the non-governmental organization. They not only provided in terms of monitoring and support to the national government, they also connected with the international NGOs and sort of a global watch on tobacco industry and the activities around them. And they also find some of the key legal instruments, which are like public interest litigation in claim for public health rights for people, and also provided a great deal of political mobilization and for that. The other key group was the media. The media response was generally positive or favorable in the whole tobacco campaign. They created a positive and opinion on the issues, generated positive stories, sharing a great deal of public awareness, creating public opinion. These were the kind of group organizations that were engaged, but we also saw a lot of engagement from individual actors. They may be like policy entrepreneurs, typically like cancer surgeons or researchers coming forward or doing that policy translating role, bridging that evidence and talking about the harms of the tobacco. And also individuals like school teachers or individuals who filed public interest litigation in benefit of human right and public health, and stating that tobacco smoking is a nuisance and something needs to be done. So these public interest litigation have been used as a tool to counter or to further deepen these tobacco control laws. The only group that has a negative effect in the whole process was the tobacco industry and their lobbying tactics. The tobacco interference can be seen in many ways. So one is lobbying, and as Connie was also mentioning, they have vested interest in policy forums, in policy dialogues, where they try to influence the decision makers. But they also try to introduce new pro-tobacco products. And also India is a tobacco producing country, and it is the second largest producer of tobacco. So there is a associated financial gains with the and livelihood associated. So that makes quite complex, and the tobacco industry leverages that and produces an alternative argument that overplays the economic and the livelihood significance. And they have also tried to file lawsuits and take the battle to a more like a legal forum, where they have tried to negate these decisions provided by the courts. In terms of what has worked for tobacco and what have been really positive drivers, if we look at a collaborative framework, the legal instrument and the political mobilization have been key, I would say, footholds for the tobacco control journey in India. The national program kind of provides the mandate and institutional structure for multisectoral engagement. And also there have, in speaking more using of legal instruments, so the tobacco control law of 2003 is not sensitive to smokeless forms of tobacco. So there are other laws which have been used to ban the smokeless forms of tobacco, like Food Safety and Drug and Cosmetic Act, which characterizes nicotine as a poisonous substance. So this has been used. So other public health acts has been used in the on legal battles to actually advocate for anti-smoking. But there remains a huge challenge for the tobacco control program, especially as I mentioned, India being the tobacco cultivator. So there is a issue of policy incoherence, because there is associated issue of livelihoods and economic gains. Where there are research institutes that promote tobacco research and tobacco growth, whereas we have a national program that kind of stops tobacco smoking. So there is an incoherence in larger policy, and there has been more efforts to stop tobacco smoking rather than tobacco cultivation and trying to rehabilitate farmers. So more supply side of interventions is needed. And the tobacco law, Act, which is 2003, is not very sensitive to like smokeless forms, point of sale. So that needs much of like a legal parliamentary processes to make them it is more stronger to current the environment of the tobacco products. Also, there is need for more funds and advocacy for the research, because the common sentiment across the stakeholders was the tobacco scenario is very active and constantly changing, because the common enemy is the tobacco industry, which is highly capable, influential, and comes out with new kind of products, which needs new kind of research and advocacy to counter those measures. So the need for more enhanced funds for tobacco advocacy and research are required.
1 minute.
Yeah, no, I think I'm stopping at this phase. Thank you.
If you wanted the last slide, please.
No, so I had initially thought of mentioning about policy implementation, but I think in terms of like what the panel has been talking about and that context, I think I kind of switched to give more weightage to the policy landscaping. So if anyone wants to have any questions in policy implementation, maybe I can take up those kind of questions if they want to, are curious about what did I find or what kind of things came out.
Okay, well, thank you so much. And I'm going to invite Belinda Townsend now, just to give a reflection about some of the key themes that you saw coming through, implications for future methodology use, future questions, any areas of interest. Thanks, Belinda.
Sure. Thanks so much, Stephanie, and thank you to the speakers. There were some really insightful presentations, really reflecting an interesting spectrum of work on this important topic of the politics of regulating harmful commodity industries. I thought I'd group some of the themes, and I'll try not to take up a lot of time so we've got time for questions. So overall, I thought, what is explicit or implicit across all of this work in these presentations is power. So how actors are using or wielding different forms of power, or how power is structuring their ability to influence the policy process. And so there are a couple of different forms of power that I thought were connected across the presentations. So the first is the role of discursive power. And this is the ability of actors to use framing to frame the agenda in ways that advance their interests or the way that they would like the agenda to go. And we know that this is a particularly useful form of power for public health actors who don't have a lot of economic power or structural power. And I think I saw this in Connie's presentation, where she was reflecting on the way that different frames were used to advance tobacco control, both the health framing, but also an economic framing. It came up in Lana's presentation on the justifications for the SSB tax in Vanuatu. Again, that sort of health framing and an economic framing. And it was also evident in Talia's presentation, but perhaps more on the negative side, where Talia was reflecting on the dominance of neoliberal ideology and the dominance of individual responsibility frames. And this is something that I've noticed in my work on the politics of agenda setting for health. And what we've found in the work that we've done is the importance of using multiple synergistic frames in order to drive the policy agenda forward. So not always using a health frame, but maybe an economic framing or a gender equality framing coupled with the health frame. And so I was thinking about this as a spectrum. So on the one hand, Connie's work was showing how you could have economic and health framings that were complementary to drive an agenda. But in Lana's, it was interesting in your abstract, Lana, you were reflecting on how health was perhaps more of an opportunistic frame, and was it really a win-win for health and economics? And then in Talia's presentation, we see the dominance of neoliberal economics a crowding out of a health frame. And so I was thinking about this in the context of COVID-19, that it's brought to the fore the relationship between economics and health, and people are seeing the importance of seeing health within an economic lens. If we have a global pandemic, that can affect our economy. So there are opportunities for using economic framings, but then there are also potential risks. And so I found that an interesting tension, and I wondered if the panelists had any reflections on the role of framing in their work. The second form of power that came up for me was the role of experts and expert authority and who has expertise. We definitely saw this come through in Gordon's presentation about the role of evidence and knowledge. And I did have a question for Gordon when you were talking about how the 4 different groups used evidence. I wanted to know if there was any difference in how those actors were using evidence. So we looked at authority claims and evidence in trade policy, and we found that industry actors almost hardly ever used any kind of peer-reviewed or scholarly evidence, and maybe that was an indicator that they had other forms of authority. And public health actors, significantly used a lot of peer-reviewed evidence. And I was thinking about the difference between Connie's presentation, where you talked about evidence and trusted experts and timely evidence as key, and Gordon's presentation, where evidence wasn't really, it didn't seem that evidence was needed to get it onto the agenda. The evidence was generated after. So I found that quite interesting, that for many of us in public health, you can get the evidence up, but what else do you need to get it onto the agenda? But then in the case, it sounded from your presentation, Gordon, that perhaps there were other things that drove it onto the agenda and the evidence could come later. So I found that quite an interesting contrast. The third form of power was the networks and coalitions. And so this came up through Shinjini's presentation, where you were sort of showing that the more connected and the denser network is, and the stronger the leadership in the network, the better outcome for tobacco control implementation, and the role of civil society in that network in playing a global watch role, and how industry actors have their own coalitions. And so both Shinjini and Connie commented on the role of tobacco industry, counter-industry groups trying to influence the agenda. And I had a question for Shinjini, which was about how successful was the tobacco industry? It didn't sound like they were as successful as watering down as they were in the case of Ukraine. And if that's the case, why did you think that was? And of course, across Lana, Connie and Shinjini's presentations, we heard the importance of coalitions within government. So both Lana and Connie commented on how the department or the Ministry of Health was working with the Department or Ministry of Finance. And Shinjini talked about the structures that had been created within government to allow that multisectoral collaboration. But in contrast, reflecting on Talia's presentation, it sounded like the structural power of the state and the dominance of a neoliberal discourse prevented that coalition forming and the success of a public health coalition. So I did have a question for Talia, which was, are there positive examples or examples of success in the case in Mexico, where coalitions have been able to overcome that structural power and the neoliberal hegemony, from your view? But overall, I thought the presentations really drove home the importance of understanding the tactics and the strategies of different actors, of government actors, industry actors, NGOs and experts, and then how they're using power in different ways, whether it's through the discourse or the use of authority and expertise or their coalitions. And so I'm interested in where this goes in terms of the future research about the terms of engagement that we have or don't have with industry actors. And so just reflecting on one thing that Connie said, which was about how the Framework Convention on Tobacco Control has a really useful article in preventing the tobacco industry from influence. But we've seen different forms or no formal rules in other areas like alcohol or food, fossil fuels or gambling. And so one area that I'm interested in is the future agenda around in what ways can you prevent conflict of interest or undue industry influence in policy development. So I've kind of rushed through that, but I want to make sure that there's time for questions. So they were sort of the key themes that I saw coming out of that.
Amazing. Thank you so much, Belinda. And I'll get all of the presenters, if you could reconvene virtually. Kathy, would you like to pose the first question, or would you like me to?
Right, so there are several interesting questions that came in. I think it also connected with several ideas that Belinda posed to our speakers today. So I'd like to start with one question around power, and I think this actually applies to everyone, although the reference is on the tobacco tax and the SSD tax. So in your studies and in the way that you've studied the field, are there obvious political interference during the time that these are deliberated on and studied and implemented in the areas where you've studied them. And the second part of the question is also, I think, important for everyone. How difficult is it to study this topic comparatively across different settings, across different countries, or even across product types? Like you have, let's say, tobacco and then sugar, sweetened beverages. So the second question refers to doing comparative studies on these items. So who would like to go first? So the first part of the question is on the political interference. And the second part of the question is doing comparative study either across the commodities or across different settings.
I'm going to throw this to Lana first.
I thought that was coming. I guess I'd start by saying that political interference per se is inevitable. This isn't a process where there is one solution that we're purely technocratically putting in place. This is a contestation of ideas. So there's going to be inherent political infighting between different levels of government, different governments of different countries, if we're talking about things that influence trade agreements, things like that. So for instance, in the Vanuatu case study, as I said, a lot of this seemed to have come out of the finance side of things. That argument between health and finance, and perhaps how it was initially framed, was that yes, it may be earmarked for health, but that didn't eventuate. So while at the kind of outset and the implementation stage, we saw agreement, perhaps now since implementation and that lack of earmarking of finances, we've seen a bit more of that argy-bargy between health and finances saying, hey, we thought we were getting extra revenue from this. So I guess to simply sum it up, I'd say there's no way there wouldn't be political interference in this process, because we're not just talking about something that we all agree on, that there's conflicts in our understanding of this problem and what the solutions could be.
So I'd be happy to address the second question about how difficult it is to study this topic in different settings and across product types. So I think there are challenges because depending on how closed or open the government is. So Ukraine, we had quite a difficult time accessing government officials despite being close to, having a relationship with the advocates working on the ground, because the government was just very close and the Ministry of Finance was just, even more close because of what they deal with. So in that sense, it's very difficult. I think another interesting thing too is that so in these two countries and in other countries we worked in, we always try to reach out to the industry to see if we can capture their perspective. But for tobacco, we found that in all our cases, almost every industry affiliate would decline or not respond. There was only one time that we were able to get an interview with someone who used to work for the industry. However, we've done this research for alcohol, and we were able to get some industry affiliated folks to respond. So I don't know if if other panelists also had the same experience, but I thought that was quite interesting.
Thank you, Connie. Gordon?
Yeah, I can also chime in there. I think in terms of the empirical context, the two countries that we had studied, Chile and Mexico, it's still evolving, the political situation there. And so with Mexico in 2018, AMLO had, just dismantled the Seguro Popular. And I'm sure, our Talia can talk more about that. But in Chile, there was also a populist movement culminating into a rewrite of the constitution. So, again, it's Kingdom has been mentioned, especially by Connie. And so these windows of opportunity are continually opening. And it's a question of, syntaxes addressing a particular social determinant of health. How does this fit into health reform and the larger political reform, right? And I think, that's difficult because our study period's capped off. And so now in the publication stage, we will probably have to explain it, and the reviewer will be wondering why when it's a limitation of our data. I also think that one of the things that was pointed out is that by Belinda is that we had 4 actor camps, but within each camp there are different subtypes of actors as well, and I can go into that. So for example, like for us, like industry interviewees was not difficult to get because we were open to interviewing global actors who were very well aware of what's happening within any country, and also regional. It was actually the country level food and beverage industry folks that were harder to get to. And but there are it's not a monolith either, right? It's like a packaging association has a stake in SSB taxes, so do grocers. And it's not just like food and beverage product producers per se, because you have to think about the entire supply chain. And so I think industry with a capital I, right? I would also say, research with capital R as well. Like in Mexico, INSP, UNAM, like, and the National Academy of Medicine, those are dominant industries that are continually producing, and one of my collaborators, Cristobal in Chile, is also one of the very active collaborators. And so I think you see, like, along with civil society, with Bloomberg Philanthropies, there are dominant players within each of the 4 types of actor groups we looked at. And so, that's in short, every category has a capital R, but then the types of actors are also really different within each camp. And I'll stop there.
Anyone else wants to add to that? And then Shinjini, you wants to say something?
Yeah, hi. I think that in specifically Indian context, what helped was because India is a tobacco producing country. So the studies which kind of projected that the revenues generated from these tobacco sources are much lower than the actual that the government has to spend if it has to counter the tobacco-related tobacco diseases, either cancers and all. So when that kind of comparative financial aspects were drawn, so that kind of provided an evidence for the national government to take a decision and finance to get on board that revenues you are producing and the kind of money that we will be spending would be much more than that. So those kind of local relevant evidence production really helped to get those buy-ins. And the one question that Belinda was asking about the tobacco industry in India. So I'm sorry if it didn't come across very evidently. Maybe I was more talking in pro of how to counter the tobacco interference. The tobacco industry does have a very, I would say, a good presence as everywhere else, but the mechanisms to counteract either through public interest litigation, political mobilization, privatization have been quite strong to counteract those initiatives. So it has been a two-way battle, especially if we look at the pictorial warnings on cigarette packaging. That kind of legal battle has been ongoing with the tobacco industry and from people and NGOs for, I think, last 10 to 12 years. So it's a very to and fro process that actually doesn't stop.
Yes, Talia?
Yes, well, as answering your question, Belinda, I would like, maybe in the presentation, it was obscured, like this reform on this fiscal reform on sugar drinks and like the the coalitions which were formed in order to advance these fiscal reform, right? Because it didn't begin the process in 2014, but it began with like small measures like 4 years before with civil society groups and as Gordon said with universities as well. But I wanted to highlight, in fact, and yes, I agree with you that in fact the state is like formed by these, well, the reforms and law reforms are formed by these coalitions. However, I wanted to highlight like how this transformation in mortality rates was produced, and to look at it through this lens that I of the facade, right? But yes, of course, I agree with you with this the role of these coalitions. I don't know if I answered your question. Okay.
All right, so excellent, excellent answers. I'd like to follow through with the last question. And there's actually still a lot interesting question, but because of time, I'll choose a question that will help us think of the future. So this is connecting all of your work to social determinants and even commercial determinants of health, and we see here that the taxes, for instance, as one form of regulation, have implications in country, but it also has implications in terms of global health and global policy. So the question is, in terms of research and also in terms of approach, conceptual approach in these topics, how do we gain balance between studying local, looking at the interventions as well as the policies at the local, individual level and country level, and looking at how we balance all the intervention, and also look at how all of these can work together in terms of countering the strength, let's say, of the multinational companies against government. So can you comment on that question?
Maybe I'll start, and I'll go backwards. In the States, there's a website, opensecrets.org, and if you go on that website, you can see, who has contributed to, in terms of lobbying dollars. And I think from a data standpoint, that's great, because then you can track, who's contributed, how much, and then you can sort it by industries, and it's annual. And so I would say, I don't like an automatic assumption of corruption. I think you really have to have like data like opensecrets.org to be able to make the connection between industry and government. And so I would advocate for that, I think, in any of the countries that we're talking about today. The other interesting thing to me is that, just again, speaking from proliferation of data, is that I think we can all agree that interventions around like smoking and obesity, it's like a Swiss Army knife, right? There's like food labeling now, it's like the next wave of the intervention. And I think, getting national statistical agencies to, ask that in household surveys, for example, I think would be a good way to go, in terms of actually really looking at the population level changes, because, in our studies, that was an argument against it. It's that, well, you're able to show like, somewhat elastic, consumption pattern, like behavioral changes, but then are you really going to be able to see the downstream changes, right? And I think data would support that. And I think, these policies are inducing that. So that's my answer from my side.
I can just add to what Gordon said about the need for data on, so in the two countries so in Philippines and Ukraine, we found that during the legislative process, there were parts. So for example, in the Philippines, this was during the BICAM, where they were trying to reconcile the House and the Senate bill. This was completely opaque. Like people don't know what happens in that process. In Ukraine, the entire legislative process is pretty much opaque, and advocates don't know what goes on. So I think in addition to like open secrets, there is a need for these countries to have legislations that's similar to the Freedom of Information Act, so that there would be such transparency and accountability of these government officials. Also, of course, I think, global efforts having frameworks like FCTC was really critical for the tobacco control movement. In the Philippines, for the sin tax, they actually, the alcohol component wasn't the taxes weren't as high because they were worried about the industries joining forces, but also because key informants said that the global movement for alcohol control wasn't as strong. But then, of course, even if you have the global movement, you need domestic movement. So I feel like it's like we need to work on everything.
I guess piggybacking off Connie, sorry, Steph, do you want to go?
No.
Oh, okay. Piggybacking on what Connie said, but kind of tangenting a little bit, I don't think it would be 2020 without bringing in the idea of decolonization into a conversation about health policy. From my perspective, I think our discussions around things like sin taxes have largely sat at the global community level because we're looking at things like trade and tax, and all of that sounds like it needs to be dealt with elsewhere. Whereas we are seeing local actors at local levels putting in place amazing policies. And that's not really being talked about because they're not jumping over these global benchmarks that organizations like WHO are wanting to see. So I think there is real need to kind of bring some of these case studies to the fore and show what is being done when local actors understand their own context, but also understand what needs to be done to keep their populations healthy. So I think it is about addressing the global, but also not losing sight of the local and how all of that is really diverse depending upon the context in which we're trying to enact these things.
Shinjini?
Yeah, hi. I just wanted to build on the same thought was occurring in my mind because when Lana was talking, same things occurred to my mind. There are like district level or sub-district level where like district commissioners and like small like district administrators have taken steps towards tobacco control, which are like anti-tobacco and prohibited some aspects of the law in their district because they have the power. So these kind of local interventions or local cases, these needs to be really brought to the forefront, especially in low and middle income context. It becomes necessary to highlight these local nuances. And there are in India, specifically for the tobacco control, the legal interventions have been very useful. So there are like smaller NGOs who kind of maintain these kind of databases, like kind of EILs find what have been the laws and all. So also looking at the different kind of other repository of knowledges rather than just only the policy documents and the trade agreements, but these kind of things can also be helpful in reviewing the overall environment of tobacco control.
Okay, Steph?
I was going to say, maybe Talia, do you want to have any final reflections before we know? Well, look, thank you everyone who has stuck with us while we tripped over time, but thank you most especially to our presenters and discussants for a really rich exploration of what I think is probably one of the areas of policy research which is going to drive us through the next decade. So I'd just like to thank Lana, Gordon, Connie, Shinjini, Talia, and Belinda for their insights. To everyone online, please do stay engaged with the Global HPR Forum. Please reach out to the presenters and to each other if you're interested in collaborating, in finding out more about what they've been talking about. Follow us on Twitter for updates on the upcoming webinars. So the next 2 Tuesdays, next Tuesday and the following, we have the final 2 webinars in this series. And thank you. Good evening, good morning, good afternoon, and stay safe. Thank you.